Okay, good morning, everyone. It's Friday, the 26th of June. Firstly, can I just apologise that the recordings haven't been coming through this week because there is a technical problem with Microsoft Teams at the moment, and that it's not allowing us to stream the recording. So I know that's being looked at. It's not a issue with us, unfortunately. So please feel free to record the webinar if you want to share it with your colleagues. These are being recorded. It's just the issue that we can't physically share the meetings because they're large files. But they are stored, and hopefully in the next week or so or less, we'll be able to share them with you. So I'm going to give you an update firstly on paediatric services in NCL. There's been a lot of questions and a lot of people have been feeling quite confused about that, and I can understand. So there's been a discussion at NCL Clinically Advisory Group, CAG, and a decision by NCL Gold. And that's really saying, and there's been some changes across NCL that have been discussed amongst the acute hospitals. And I can tell you that paediatric inpatient beds have reopened at North Middlesex Hospital a couple of weeks ago, as you probably already know, but I thought I'd remind you. But what is new from this week is that they reopened beds at UCLH, Whittington, the Royal Free, that's the Hampstead site, from this Monday gone. And there's also the Integrated Physical and Mental Health Crisis Inpatient Service, which has moved from Gosh back to the Whittington. So that's really important to know. There'll be more updates in the coming weeks. And so certainly these decisions are made sort of by chief executives of hospitals and paediatric teams. So and obviously I know there's been lots of questions about what's happening at the Barnet Hospital, which is one of our local ones, and we should be hearing about whether that's going to be open up in the next week or so. The next thing I'm going to tell you about is risk assessments. There's a lot of questions about what should we be doing with patients, what we should be saying is that any clinician with the following condition should not see anyone face to face. And that's really until the end of the shielding process. So if we're thinking about our own staff and practices, we need to make sure we've done risk assessments for them. And really, just to give you a heads up on what particular conditions we're thinking about are any of our staff members who have got organ transplants or who have had cancer and undergoing chemotherapy or radiotherapy, or on any immunotherapy or continuing antibody treatments for cancer, or have had a bone marrow or stem cell transplant in the last 6 months, anyone with a severe respiratory condition, so severe asthma or severe COPD, anyone with those kind of rare conditions or infections, or anyone on immunosuppression therapies sufficient to significantly increase their risk of infection, and anyone who's pregnant with significant heart disease, whether that's congenital or acquired. So I think these people are classified as extremely vulnerable. And so as employers, we need to make sure we've done risk assessments on those, and there's lots of guidance out there to support. The next thing I want to update you on is lots of questions come out, and even I had this question earlier in the week about the letter that we got sent from NHS England about the new shielding letter. And just to provide some clarity, that NHS England have sent these letters out to patients centrally. But what we can say is from the 6th of July, the extremely vulnerable, obviously if they wish, can now go out into groups of 6, but they must be outdoors, including those from different households. There's lots of questions that are coming up about that. And then from the 1st of August, there's no, as long as there's no significant increases in incidence, then the guidance will be relaxed. But I think the key thing there is what the government said is that if there's no increases in incidence, so this is what their plan is from the 1st of August, but obviously things can change. So what we're saying is those people can then go back to work if they can't work from home, as long as the business is COVID safe. And children who are extremely vulnerable can return to education settings in line with their peers, and people can go out to places like to buy food, places of worship. And in Barnet, we are creating a list of places of worship that are COVID safe, and that's being produced right now by the London Borough Barnet, and it will be available freely online when it's finalised. So I think really what we're saying to patients, if they ask us, what does that mean? Well, everyone should remain cautious, as they're at risk of catching coronavirus. We all are. But those in the extremely vulnerable group are still at risk. So they should still stay at home where possible and follow social distancing. The next thing I wanted to give you an update on is about the Medication Authorisation Administration Record Chart webinar. That is next Thursday, so that's the 2nd of July at 1:30. So This is quite a good webinar, maybe for some of the staff within our practices. So it's a new end-of-life medical authorization administration record, which has been created by London-wide clinical advisory group, and it will be used across NCL from the 6th of July. And it's for all GP practices to go through the new MAR chart. And there's Dr. Rachel Craig and Jonathan Sheldon from the Royal Free, Rachel Craig's from the Royal Free Hospital and Jonathan Sheldon's from Camden, and he's the end of life care GP clinical lead. So I think there's some big changes there to try and improve the way that we're using MAR charts. So it might be worth it going on that webinar. The details are in the bulletins. And the next thing as well is about the restoration of immunisation, and there is also webinars that Public Health are running that might be good for our nursing staff or healthcare workers in the practice, and it's going to be delivered between 30th of June and the 2nd of July, and it's going to be recorded. Each will be a formal presentation of the same content for 30 minutes and then 20 to 25 minutes of questions, and again the details of that are on the webinar. On the bulletin, sorry. The next update I wanted to give you is about phlebotomy. I know there's been a lot of questions about what's going on in phlebotomy, and so I wanted to just tell you that the Royal Free are going to go back into Edgware Community Hospital in the next 2 to 3 weeks, and so I'll give you an update when that occurs, and they'll be using that site again for phlebotomy. We've also increased capacity from Monday at Finchley Memorial Hospital, which is run by CLCH. So they're increasing their capacity by 40 appointments per day from Monday. But it's really important to remind colleagues that obviously please do not tell people just to turn up there without an appointment. It is an appointment system. It's just like we wouldn't have patients turning up at our practice because of the coronavirus risk. And that's really important. But what's also really important is that although the Royal Free and Chase Farm are doing routine bloods, Finchley is saying we're only doing urgent or essential blood. So this isn't someone saying, oh, I need my annual lipids checked or my annual thyroid function. This is kind of the essential things like your NOAC monitoring, your methotrexate monitoring, or someone who's acutely well that needs urgent blood tests at Finchley, because the capacity isn't still quite there. So it's up to clinicians to decide what's urgent or essential, but certainly please don't send routine ones just yet to Finchley. In the next 2 weeks, once capacity is increased at Finchley and at the Royal Free and at Edgware, there will be huge amounts of capacity hopefully flowing to the system to allow us to reconvene routine blood tests. And that's going to be an NCL comms coming out in the next couple of weeks. And then the final thing is in terms of technology, what we're working on at the moment across NCL is a digital solution, so that when we order a blood test form, a bit like when we order an ultrasound scan, it goes directly through to the provider. So you'll select the provider like you would do, like it will say Barnet, Edgware, Finchley on the drop-down list, and it will go to that provider. And so you won't have to print out the form, you won't have to email the form or whatever you've been doing over the last few weeks, and it will go directly to the provider. So it's a new thing that's going to be trialled initially in about 4 weeks. We're just trying to get the technology sorted out with TQuest, and it will be trialled not in Barnet, but will be trialled in I think it's Enfield for about 2 weeks, just to see if there's any teething problems. And then I'm hoping by August we will be able to roll that out, or even September, depending on how long things take. And I think that's a really fantastic way. We've been asking for something like this for a long time. And I think, the coronavirus situation just pushed things forward, which is fantastic. The final thing I just wanted to remind everyone is about Consultant Connect. And what's really interesting is that the hot weather's clearly brought out a lot of patients to see moles, because we had 35 Consultant Connect dermatology yesterday, all for moles and skin lesions, and probably picked up when people have been sunbathing. So it's really interesting. But keep using it, and just to remind everyone that the cardiologists at Barnet and Royal Free are on Consultant Connect, and in the next couple of weeks we'll be introducing more Royal Free and NCL consultants. I'm just going to move over to the chat bar and a couple of questions. So Barnet Hospital isn't doing bloods at the moment and is expected to restart in the coming weeks. If you're asking about the paediatrics team there, the paediatric Barnet will be opening again in a couple of weeks. We're waiting for comms. And then the blood test at Finchley Memorial, yes, absolutely. The idea is that it goes to all providers, not just the Royal Free ones. And when you order a form, you'll be able to select Finchley, which is part of CO. That's the plan. It might be that slightly slower than the Raw Free to take off, because remember, they don't have the same software as us or the Raw Free. So certainly that might take a little bit longer, but that is the plan, is that, you know, every provider will be on there. If anyone's got any other questions, do pop it in the chat bar. Just let me know. I can answer them another point or next week. But otherwise, I'm going to let you go and enjoy the great weather today. And hopefully surgeries aren't too busy, but I am in the surgery today. Thanks very much, everyone. Go ahead.
Thank you.
Thanks, Nick.
Take care. Bye-bye.